welcome to The Doctor is In, your daily guide to virtual care in this time of the coronavirus. I'm Dr. Freddie Gomez, and we're looking forward to answering your many questions over the next half hour. So while we're waiting for the COVID-19 vaccine, experts are testing antiviral drugs that hope to slow down disease progression or improve the survival rate of COVID-19 patients. Recently, the Philippines participated in what the World Health Organization called a solidarity clinical trial for COVID-19. Today, we'll talk about that clinical trial and how this is one step closer to what we all want, which is a cure or a vaccine for COVID-19. Also, we will tackle the important public health measures commuters should be aware of during the general community quarantine. So, with that, let's get on with this discussion. We are joined today by the team leader for the Philippine Solidarity Clinical Trial, Dr. Marissa Alejandria. Welcome to the show, Dr. Alejandria.
Good afternoon, Dr. Freddie. Good afternoon.
Thank you for joining us. Now, Dr. Alejandria, when I hear about solidarity, it comes to me as a word that signifies oneness, unity, people going towards a unified goal. So when we hear solidarity clinical trial, what is this? Could you tell us more about this?
Okay. The Solidarity Clinical Trial is a public health emergency trial that was organized by WHO for its member countries. So solidarity means pagkakaisa. So the countries participating in the trial are working together to answer the question on which of the antiviral drugs that have activity against SARS-CoV-2 will be effective in the cure for COVID-19. Okay. So the trial involves more than 20 countries. Actually, there were about 80 countries who expressed interest, but currently there are 20 countries participating actively in the trial. And in our country, it's sponsored by the Department of Health and the Department of Science and Technology, Philippine Council for Health Research and Development. Our participation is supported by the Department of Health and DOST-PCHRD. So yun siya. It's an international, multi-country clinical trial.
So, pag-uusapan natin a little bit more on yung mga treatments na kasama dun sa trial, But really quick, let's answer probably a question from our social media panel or questions that were given in through social media. We have one from Kay. Ang tanong niya is, pwede rin po ba isali sa trial ang mga suspected cases pa lamang?
Okay. Yes, may criteria tayo for including patients, yung mga suspected based on their symptoms, chest x-ray, CT scan finding, CBC, yung blood test, tsaka kung sila ay na-expose sa may history na na-expose sa isang pasyente na suspected din or confirmed case ng COVID. So pwedeng sumali ang suspected cases base sa assessment ng kanilang mga physician.
Okay, so marami pa tayong tanong na sasagutin with regards to this very interesting trial. But first, we have to pause for a quick break. When we return, let's get to know each antiviral drug that will be used in this clinical study. We'll be right back. welcome to the Doctors In. I'm Dr. Freddie Gomez. So while you're staying safe at home, we hope that we could provide you with medical advice that you need. So the World Health Organization, for that matter, started its Solidarity clinical trial on COVID-19, and that is what we are discussing today. Before the break, we were discussing what exactly is this Solidarity clinical trial. Now we will be discussing what benefit Filipinos can have from this. So with us is Dr. Marissa Alejandria. She is the team leader and WHO representative for the Philippines in this clinical trial. Dr. Isa, Dr. Isa, before we
Yes.
continue on with the conversation, sino-sino yung mga participants ng clinical trial na ito? Sino mga pwedeng sumali dito sa trial?
Ang pwedeng sumali ay mga pasyente na suspected or confirmed cases ng COVID-19. So base sa assessment ng mga kanilang attending physician.
Okay, so now let's talk about yung mga treatment options yung kasama dito sa study. No? We've heard a lot about these antiviral drugs online. Pero ano-ano ba talaga ang pagkakaiba ng apat na gamot na kasama dito sa trial?
Okay. Yung apat na gamot na kasali sa trial, yung hydroxychloroquine, lopinavir, ritonavir, remdesivir, tsaka lopinavir, ritonavir plus interferon. Okay. And then we are comparing it against yung standard of care. So any one of the 4 drugs plus standard of care versus standard of care alone. Anong kaibahan? Itong hydroxychloroquine, lahat sila ay may activity against SARS-CoV-2 based on clinical studies, no? Preclinical studies. Yung hydroxychloroquine, na-establish na yan na gamot sa malaria, sa rheumatoid arthritis at saka sa lupus. Ngayon, tinatry natin siyang gamitin kung tinetest natin dito sa trial na to kung effective ba siya sa SARS-CoV-2. Kasi sa laboratory, nakita na meron siyang activity against SARS-CoV-2. Ngayon, gusto nating makita kung sa mga may sakit ay makikita natin yung epekto na yon na nakita sa laboratory. Next is yung lopinavir, ritonavir, approved drug yan for HIV. Again, may action din siya sa SARS-CoV-2. Pine-prevent niya yung multiply ng virus sa circulation. No? So, tinitingnan din kung effective siya sa mga may sakit ng COVID-19. No? Again, nakita kasi sa laboratory na may activity ang lopinavir, ritonavir sa SARS-CoV-2. And then yung remdesivir naman, nagamit na to sa mga clinical trials sa Ebola virus, okay? At saka sa MERS-CoV. Okay? So, kasi kaya itong mga drugs na to ang tinatrial, ang SARS-CoV-2 kasi ay kamag-anak ng SARS at saka ng MERS-CoV. So, meron silang relation in terms of genes, no? So, kaya ang tinetest natin is kung kaya din ba nitong mga gamot na to ang SARS-CoV-2 naman na sanhi ng COVID-19. Yung interferon, ganun din, kino-combine siya with the lopinavir, ritonavir. Ang interferon ay immunomodulator, so ginagamit siya currently for multiple sclerosis, and ang indication niya is to combine it with lopinavir, ritonavir, so antiviral plus immunomodulator. So yun yung apat na gamot na kinukumpara natin.
Oh, that's good. So, ilang participants ang target ng study na ito? Ilang Filipinos ang tina-target para masama dito sa study?
Okay. Ito kasing trial ay international, no? Tapos ang ginagamit na design tinatawag namin na adaptive. So hindi talaga nakaset kung ganong karaming pasyente ang isasali. So depende kung ilan na yung nakikita na may nagmo-monitor kasi niyan yung tinatawag natin na Data Safety Monitoring Committee. Sila ang nag-check kung tama na ba yung number ng mga pasyente na na-enroll. Usually in the thousands. So actually ang parang prospective target is 5,000 for the whole solidarity trial, not just the Philippines, no. Sa Philippines at least nagta-target tayo na makakontribute ng 500 patients dito sa trial na to. Sa ngayon, as of last week, meron ng 3,600 patients na naka-enroll sa trial across all countries, among the 20 countries that are participating in the trial. And sa atin, sa Pilipinas, 250 patients na yung naka-enroll as of today.
Okay, so a lot of people are really excited to find out the results of this study, kung alin ba talaga dun sa mga gamot ang napatunayang effective. Ano? Thank you very much, Dr. Isa Alejandra, for joining us. But before you go, do you have a message for our viewers, probably kung paano sila posibleng makisama, makasali dito sa trial na ito?
Okay. So pag kayo po ay na-admit dahil suspected kayo ng may COVID-19 at ang inyong physician ay inoffer sa inyo na sumali sa clinical trial, sana po ay pumayag po kayo. Titingnan naman po kung may contraindication, ipapaliwanag sa inyo kung paano yung pagsali sa clinical trial. So meron po tayong 27 hospitals na kasali dito sa clinical trial dito sa Pilipinas. Meron tayong 9 government hospitals and another 18 na private hospitals. Meron din po sa probinsya, hindi lang sa NCR. So meron tayo sa Davao, sa Southern Philippine Medical Center, sa Cebu, Vicente Soto, Perpetual Socorro Cebu Doctors Chongwa. Tapos sa North Baguio, sa South Batangas Medical Center. Tapos dito sa Manila, so Lang Center, PGA, San Lazaro, RITM, East Avenue. Tapos sa mga private, Makati Medical Center, Medical City, St. Luke's, Global, QC, ayan. Cardinal, Asian, Manila Doctors, Manila Medical Center, Chinese Gen, San Juan de Dios, World City, Fidel Mundo, UERM. So, sana po, ito yung pagkakataon na makakontribute tayo sa science, sa kaalaman, no? Kung alin dito sa mga gamot na to ang epektibo laban sa COVID-19. Sa ngayon po, wala pa talagang gamot na masasabing effective conclusively against COVID-19. So, kaya po nagtulong-tulong ang lahat ng bansa, no, para mabilis nating masagot ang katanungan kung ano nga bang gamot ang epektibo laban sa COVID-19 habang nag-aantay tayo ng vaccine.
All right, thank you very much, Dr. Marissa Alejandria, for joining us in this discussion today. When we return, we will talk about important public health measures, especially for commuters as people head back to work. Please stay tuned. The doctor is in. We'll be right back. Hi, and welcome to the Doctor's In. I'm Dr. Freddie Gomez. So we're in the second week of the general community quarantine at habang sinusubukan ibalik sa normal ang lahat, hindi pa rin po nawawala ang banta ng COVID-19. Workers and commuters have to be very careful as they travel back and forth from their home to their office. So let's talk about the important public health measures bilang paalala na rin sa ating mga kababayan. We have on the program Dr. Susan Mercado, who is a public health expert and is here to talk about this matter. Welcome to the show, Dr. Mercado.
Hello, Freddie. Good afternoon.
We're glad to have you, Dr. Mercado. Ngayon na GCQ na, what are the things that the commuters should do to protect themselves from COVID-19?
Well, you have to wear that mask, no? Kailangan lagi tayong nakamask. And be careful about what you're touching kasi baka may mga hinahawakan kayo na madumi. Kailangan naghuhugas kayo ng kamay palagi at saka nag-hand sanitizer. And then keep 1 meter distance away from anybody. Now, inside the vehicle, if you're in a public transportation vehicle, you have to keep your mask on because somebody might sneeze or somebody might cough, and you might say, oh, somebody sneezed or somebody coughed and I didn't have my mask on. So it's better to keep your mask on anytime you're in the presence of other people.
Okay, that's good to know. And that's definitely good advice. And also, we see the efforts of public transportation to also protect their passengers from possible infection. So, nandyan ang paglalagay ng mga plastic barriers in between seats. Nakita natin to sa mga bus at sa mga jeepneys. At marami pang iba, no? Uh, ito ba yung nakakatulong? Is this enough, do you think, Dr. Mercado, to that people should feel safe that these are in place?
I don't think we can ever really feel safe. You really have to do something to protect yourself. So you have to keep that mask on, you have to wash your hands, and you have to keep a distance. Now, this plastic that you're showing right now, that provides an additional barrier. So that reminds people about the distance. I'm not sure how much protection it can give, but it will certainly keep you away from sitting too close to somebody else. And in that sense, the distance gives you a little bit more protection.
Okay. Now, before we answer social media questions, Dr. Mercado, as a public health expert and as one of the highest members at the World Health Organization, the WHO released a new guidelines lately about wearing face masks. Could you tell us more about this?
Well, many countries started to wear face masks even before WHO gave new guidelines for the simple reason that we were all reading the same research, which was showing that there are micro droplets that can be in the air that you may accidentally inhale when you are too close to somebody. So the mask, in countries that have used the mask, they have seen that there is much less transmission than in places where you are not using a mask. So the other thing also is that these new guidelines talk about how to wear the mask, that you should actually wash your hands before you put on the mask, and then don't touch it. Stop moving it around, touching things and then touching the mask. Stop touching that mask. Once you put it on, just leave it on. And then before you take it out, you have to wash your hands again, remove your mask, and then wash your hands one more time. So we really have to treat this mask differently. It's not just something you put there, you touch it, you put it on the table, and then you use it again. No. There is a way to use the mask properly, and that way is to use it with very clean hands. Now, the second thing is, it is advised that the public uses cloth masks. And I would advise people to use a cloth mask for the simple reason that you can wash it. If you're going to use the surgical mask, you can only use that once. And in fact, those who use surgical masks know that when you start to perspire, it's very uncomfortable. You have to change it and throw it. So it's very expensive. Better to have 2 or 3 face masks, wash them, you put one on. If you start to perspire, your baon face mask, you put it on, then you wash them again in the evening. So it's cheaper, it's more reliable, and it gives you the same level of protection, which is a physical barrier against inhaling or even spreading microdroplets.
All right, very good advice, Dr. Mercado. We have one social media question, our first social media question from Michelle. She's asking, kapag sumakay ng MRT or buses na air-conditioned, okay lang po ba na tanggalin ang face masks?
Para sa akin, wag niyong tanggalin yung face mask niyo, no? Kasi baka may biglang dumaan doon na biglang umatsing o biglang umubo at masyadong huli ng lahat. So, kailangan nakamask kayo palagi dahil hindi natin alam kung yung ibang pasahero may sintomas at biglang umubo, biglaan yung may isip na ko, di ba, baka malanghap ko yon. Whereas kung nakamask kayo, okay lang, no? May distance, tapos nakamask kayo, meron kayong konting protection.
Okay, unfortunately, that's all the time we have for this program. But thank you very much, Dr. Susan Mercado, for joining us and that very insightful discussion that you had, especially on the face masks.
Thank you very much, Freddie. Stay safe.
Stay safe too. At salamat din sa pagsama sa amin ngayong hapon at sana ay nasagot namin ang inyong katanungan. Please do join me again tomorrow at 3:30 p.m. on The Doctor is In. I'm Dr. Freddie Gomez. Stay safe, everyone.